In Medical Matters today, we're talking with Dr. Antoine Keller. He's a cardiovascular and thoracic surgeon at St. Dominic's Hospital here in Jackson. And he's here to kick off St. Dominic's Heart Month. It's during the month of February, and specifically discuss heart valve disease. Welcome, Dr. Keller. Thank you so much for being with us.
Thank you for having me, Maggie.
Now, we have been hearing so much more about heart valve disease lately. Is there an epidemic? Are there growing numbers? Why are we hearing so much about it specifically now?
Well, it's very interesting that in the last several years, we have had a lot of technology centered around heart valve disease come into the market and be commercially available for people who have heart valve disease. So it's not that it is becoming more prevalent, although as the population ages, we're going to see more and more people with heart disease. But part of it is because we have so much more technology to be able to help treat people with heart valve disease minimally invasively or non-invasively, and have them live long, healthy, happy lives. And the most impressive thing to me, and I'm very passionate about it, is taking care of people with aortic stenosis, because as soon as you fix their heart valve, they feel like $1 million. And they go on and have a life expectancy that's just as if they'd never had that problem at all. So it's really impressive, and it really gives me a lot of satisfaction to be able to see these people get out and do the things that they like to do again.
What exactly is heart valve disease, and how do I know whether I have it? How do you find it?
Many people have been told that they have heart murmurs, and a lot of people have heart murmurs from the time that they're children. Sometimes in patients who are older, they develop heart murmurs that are related to aortic stenosis, which is a narrowing of the heart valve. And the aortic valve is the valve that keeps the blood moving in one direction as your heart pumps the blood to the rest of your body. When that valve becomes narrowed or stenosed, we have a problem that develops called heart failure. And the heart failure causes them to be short of breath and to have a low exercise tolerance, sometimes chest pain. If we open that valve back up, people generally do not have to worry about heart failure anymore, and they can go on and do the kinds of activities that they like to do.
You mentioned stenosis. Tell me about heart stenosis, and you actually brought some props with you today. Well, let's talk about how would you treat that?
So aortic stenosis is a problem because of the fact that the blood can't leave the heart like it used to. In order to be able to allow the blood to be able to have full egress out of the heart, we have to open up that space where the valve has become narrow. And we do that with this little piece of technology here many times. It's called the transcatheter heart valve. We can go through a little needle stick in the groin, snake this little prosthesis up through the patient's body, deposit it in the aortic valve, which is here, and it stretches the old valve that the patients have in their body and puts a new valve that's made out of the sac that covers the heart of a cow. It's called bovine pericardium. It allows that valve to have a full opening for the blood to be able to leave the heart again.
Now, what is my life expectancy if I have to have this particular treatment?
Well, this particular treatment allows people to have a life expectancy just as if they'd never had this problem at all. We can do this operation because it is so minimally invasive in people who are in their 80s and 90s even, and have them go on and get back up on their tractor or continue to do the things around the house that they like to do, and really has changed the paradigm for treating people, especially elderly people with aortic valve disease.
Now, only elderly people get this disease, or can anyone have it?
No, actually aortic stenosis is a disease of aging. So as people get older, they are more likely to be able to have been found to have aortic stenosis. But it does occur in people who are younger, especially people who have congenitally abnormal valves, bicuspid valves, which only have 2 leaflets instead of 3, or patients who have had other kinds of infections in their heart, for instance, like we call it endocarditis. So it does happen in people who are younger sometimes. The most important thing is for you to have a regular appointment with your doctor, especially if you've been told that you have a heart murmur. And then if you have a heart murmur, to go to some cardiovascular professional, someone who takes care of these things all the time, a cardiologist or a cardiac surgeon, so that they can keep an eye on it. And if you start to have problems, they can intervene upon that sooner rather than later, before there is irreversible damage to your heart.
Thank you so much, Dr. Keller. Again, we've been talking with Dr. Antoine Keller, and he's with St. Dominic. And remember, February is Heart Health Month, so take care of your heart. We'll take another look at your First Alert forecast, but first, here's a look at what's on tonight, right here on WLBT. Bye.